Hey guys, welcome back to my channel. I have been gone because I've been working on this project for you guys. I created this video to help you guys with pharmacology because a lot of people really struggle with this subject. So within this video, I broke up the PowerPoints in sections. At the top in circle, that is the ending of the drug name. So it will help you be able to remember the drugs, and it will help you be able to differentiate the drugs more easily from others. You will see some things that are in red. That is the most top tested things on the Nclex based on that drug or important information that you want to know. Lastly, you will see things at the bottom of the slide underneath a line. Everything underneath that line is just additional information that I've taken from UWorld and Archer Review or other study materials that I've used. And this video is just to help you guys and to narrow down all the drugs that you need to know for the Nclex. I want you guys to succeed, and I want this to be a simple and easy process to pass the Nclex. Thank you so much for tuning in, and let's get started in the video. Within the anticoagulants, what you would realize is that a lot of them end in "rin." There's heparin, warfarin, enoxaparin. They all end in "rin." So that is like a little sign that, hey, maybe this is an anticoagulant. Anticoagulants are blood thinners or drugs that prevent or slows down clots. So let's talk about heparin. Heparin is used to slow and prevent clots from forming. So if you had a stroke, chronic AFib, or post-op, more than likely this is the drug for you. You want to make sure when you're taking heparin that you have a therapeutic APTT, and that is your therapeutic numbers, 46 to 70. This is usually 1.5 or 2 times the normal range. And the normal range is 21 to 35 seconds. And heparin is given in the hospital. Some nursing considerations that you should keep in mind is that you need to have your APTT levels drawn every 4 to 6 hours, and you want to monitor for bleeding in the blood, bleeding in the urine, if you have bruising on your skin. You also want to monitor for your platelet levels, and in the next slide, I'll explain to you why. Another important tip that you must remember about heparin is the antidote. The antidote for heparin is protamine sulfate. The reason why you want to monitor for platelet levels is because of HIT. HIT stands for heparin-induced thrombocytopenia and thrombosis. This usually occurs 5 to 10 days after the use of heparin, and this is just simply an unexplained platelet drop, which is also known as thrombocytopenia. So one of the clinical manifestations is that your patient will have a fever, chills, shortness of breath, chest pain, or skin lesions at the heparin site. So this is extremely dangerous for your patient because they are at risk for clotting. And what you want to do is to discontinue all use of the heparin treatment. You want to start with a different anticoagulant. Now let's talk about warfarin. Warfarin is used at home, and it is used if you have a venous thrombosis, pulmonary embolism, or AFib. The same nursing considerations as before. You want to monitor for bleeding, but instead of monitoring APTT levels, now you're going to be monitoring PT levels and INR levels. Here are the ranges that you should keep in consideration. And you want to also remember the antidotes. The antidote is vitamin K, and this drug is contraindicated for pregnancy. So if you are pregnant, you should not be on warfarin. Some other things that you want to keep in mind with warfarin is that you do not want to decrease or increase the consumption of vitamin K foods. This is because if you decrease consumption, this will increase bleeding, and if you increase eating a lot of vitamin K foods, this will decrease the effectiveness of warfarin. I created this slide so you can see the difference between heparin and warfarin. You have to monitor the platelet levels and the APTT levels, and the antidote is protamine sulfate. Warfarin, you have to monitor the PT levels and INR levels. Its antidote is vitamin K, and it's contraindicated during pregnancy. And how I remember heparin compared to warfarin is that you have to monitor APTT levels, and heparin has an A and a P in the name. Its antidote is protamine sulfate, and I remember that by the P in the word heparin. Okay, so let's talk about anticonvulsants. I remember these as seizure medications. So the first one that we're going to talk about is phenytoin. Phenytoin is used to prevent seizures. It is not a treatment of seizures. So if someone is having a seizure, you would use Ativan. But if you're trying to prevent another seizure from happening, you would use phenytoin. With phenytoin, you want to remember the therapeutic levels, which is 10 to 20. You also want to remember the side effects, which is gingival hyperplasia, which is basically excess buildup of the gum tissue around your teeth. So you want them to have regular dental checkups, and you want to advise them to use a soft bristle toothbrush. Some extra things that I think you should keep in mind with phenytoin is that antacids can reduce the effect of phenytoin and should be avoided. Some example of antacids are sodium bicarbonate and calcium carbonates. Another thing that you want to keep in mind with phenytoin is Stevens-Johnson syndrome. So this is a flu-like symptom with a rash that looks like a burn. And some of the signs and symptoms can be gait unsteadiness or side-to-side eye movements. Anti-anxiety agents. These are our benzodiazepines. These end with PAM and LAM. They are short-acting, intermediate-acting, and long-acting. Right now, we are going to talk about lorazepam. It is also known as Ativan, and this is the first-line treatment for seizures. So some of the nursing considerations that you would like to remember is you want to avoid alcohol, and you want to also monitor for respiratory depression. And the antidote for lorazepam is flumazenil. Let's talk about antidepressants. So there are SSRIs, TCAs, and MAOIs. SSRIs. SSRIs are also the first starting point treatment with depression. One thing that you want to monitor for are hypertension, confusion, ataxia, sweating. These are all signs and symptoms of serotonin syndrome. You also want to monitor for suicide precautions because their mood will improve and now they'll have the energy to follow through with the plan. And some extra things that you want to keep in mind is that it can cause weight gain and also sexual dysfunction. Next, we have our TCAs, and here are some examples of TCA names. What I would like for you to remember is that they end with tryptylene. Anytime that you see these names, you can automatically remember it as a TCA. You want to monitor for anticholinergic side effects, which is dry mouth, constipation, urinary retention. So I say it like this: I can't see, can't pee, can't spit. And there's another one, but I'm not going to say it. If you know, comment down below. But that is an easy way to remember TCAs. MAOIs. So one of the nursing considerations that you want to remember with these is that you want to avoid foods that are high in thiamine. And these are foods that are aged. So aged cheese, wine, pickled meats. You don't want your patients to be consuming these kind of foods. And the side effect, hypertensive crisis, which can increase the risk for stroke. Let's talk about lithium. Lithium is used with bipolar disorder and it's a mood stabilizer. So you do not want to administer lithium with NSAIDs. You want to remember the therapeutic level, which is 0.6 to 1.2. And you also want to remember that 1.5 is toxic. And you don't want that because you don't want your client to be dehydrated. Remember, lithium is salt, and this is what's going to decrease the excitability in a patient that is suffering from mania. You want to encourage fluid intake because this medication is drying them out. And some of the side effects of taking this medication is seizures, fatigue, confusion, nausea, anorexia, tremors. And if your patient is dehydrated, you want to hold the dose. Antipsychotics. Here are some examples of some names of the antipsychotics, but right now we're going to be focusing on haloperidol. So this drug is used for schizophrenia, mania, or just aggressive behavior. You want to monitor for extrapyramidal side effects. And once this happens, you want to discontinue the drug. This is tremors, slurred speech, ataxia, tardive dyskinesia. This is voluntary repetitive body movement like grimacing face or lip smacking. And this is a sign that there's too much haloperidol in the body, and this is a medical emergency. There's also neuroleptic malignant syndrome, which is a fever, muscle rigidity, or altered mental status. With haloperidol, you also need to monitor their EKGs because this can prolong the QT intervals. And of course, this drug is also contraindicated in pregnancy. Antihistamines, these are my favorite kind of drugs. They end with "ine", and this drug is also Benadryl. So this is another way to remember it. With diphenhydramine, it is used if you have an allergic reaction, anaphylactics, or with sedation. Antihistamine is used to prevent an allergic reaction. So whenever you take these drugs, you want to monitor for drowsiness and you want to also monitor for anticholinergic effects, which is, like I said before, I can't see, can't pee, can't spit. Those are the side effects of anticholinergic effects. With diuretics, I think of them and remember them as my fluid wasters. These are the drugs that makes you pee. So with the diuretics, there are loop diuretics, potassium sparing diuretics, and thiazide diuretics. And you can remember them by "ide" and "one". That is what they mostly end in. With loop diuretics, the most common ones are NLCEX, also known as furosemide. So loop diuretics are used if you want to increase urinary output, decrease edema, if they have congested heart failure, or for use of blood pressure management. And with loop diuretics, they decrease potassium and fluid. So because of this, you want to monitor potassium levels because you don't want your patient to become hypokalemic. And these are the most effective diuretics that are used. Potassium sparing diuretics, a most common one is spironolactone. Potassium sparing, it's in the name, it spares potassium. So because of that, you want to also monitor potassium levels because you don't want them to be hyperkalemic. And this drug can also be used with loop diuretics or thiazide diuretics. And last but not least, thiazide diuretics. So this is used for congestive heart failure and hypertension. And these drugs, they increase the amount of water reabsorption, so this increases urine output. What you want to monitor with this drug is electrolyte levels, and you also want to monitor their blood pressure. About antihypertensives. Antihypertensives are blood pressure medications. There are a lot of antihypertensive. There are ACE inhibitors, angio-2 receptor blockers, there are calcium channel blockers, beta blockers. There are a lot, but I'm going to break them down into simplest form. And all of these drugs that I just named out, all four of them, these drugs can cause orthostatic hypertension. And I'll explain to you more in detail as we go along. Enalapril. This is used for hypertensive, like I said before, blood pressure, or congestive heart failure. So one thing you want to remember about enalapril is that it can cause a dry cough. And if it does, that means it needs to be discontinued. You want to monitor your blood pressure, of course. You don't want to give it if it's too low. And you want to also monitor potassium levels. This drug is contraindicated during pregnancy, so you don't want to give this to your pregnant women. And some special notes that you want to take about this drug is that it can cause angioedema, which is swelling of the face, tongue, and lips. You want to teach your clients to rise slowly if they are sitting. So if they're laying down, you want to sit them up in the bed first and then wait a few seconds and then they can stand up. And you want them to stand up slowly. You also want to keep in mind that they should avoid salt substitute because this can increase potassium. And a way to remember ACE inhibitors is that they will end in pril. Losartan. Losartan is a ARB, and it is used not only for hypertension but diabetes, neuropathy, used for congestive heart failure. Some of the nursing considerations that you want to keep in mind is you want to monitor fluid levels, blood pressure, renal and liver status, and also remember that this is also contraindicated in pregnancy as well. All ARBs will end in sartan. So if you see sartan, best believe that it is an ARB. Amlodipine. Amlodipine is a calcium channel blocker, so it will end with dipine, and this is used for hypertension and angina. An important thing to remember about this drug is that you want to avoid grapefruit juice and grapefruit itself. This can decrease the effectiveness of the drug. Also, you want to remember to monitor the blood pressure because this can cause hypostatic hypotension. So before you give any kind of blood pressure medication, you want to always check the blood pressure before you administer the drug. This can also cause gingival hyperplasia. And some of the adverse effects is dizziness because of the decrease in blood pressure. So we're going to move on to our beta blocker, and that is our propranolol. And all beta blockers end with low. That is how you will remember it. And the indication for that would be hypertension or angina. So you do not want to discontinue any kind of beta blocker abruptly. You want to decrease on the dosage and wean yourself off, but the doctor will definitely help you do that. This drug can also mask signs of hypoglycemia, so you want to make sure that you monitor your blood sugar. You also want to assess any history of asthma because this can cause bronchoconstriction and bronchospasm. So with beta blockers, they decrease your heart rate, which leads to decreased blood pressure. Our antiarrhythmics, amiodarone, our atropine, our procainamide, and our adenosine. So with these drugs, they treat irregular heart rate. With adenosine, this is basically a cardio version, which is a reset of the heart. There will be a period of asystole after administration, so you want to warn the client about the pain that they will feel. And if there's family around, you also want to warn the family that there will be a flat line on the monitor. In order for this drug to work, you want to push this drug very fast, within 2 seconds, and you want to use a central line that is closest to the heart. And when using this drug as well, you want to use extreme caution in people who have asthma. Next is atropine. So atropine is an antiarrhythmic, but it's also an anticholinergic. And remember, we talked about anticholinergics, and anticholinergic, just to remind you, is drugs that makes us feel like we can't pee, we can't see, and we can't spit. So one of the indications, or one of the reasons why you would want to use atropine, is because of excess secretions, but also because of sinus bradycardia. So this increases the heart rate and decreases secretion. And you want to monitor for urinary retention and constipation. You also want to avoid using this drug with clients with glaucoma. Next is digoxin. So one of the indications for digoxin is heart failure, AFib, A-flutter, congested heart failure, or cardiogenic shock. So the way digoxin works is it increases your contractility, which is how strong the heart pumps, and it decreases the rate, which leads to more or increase of cardiac output. So it increases the strength of how hard the pump is, decreases how fast it beats, which increases the cardiac output. And with digoxin, it is very important for you to monitor the signs and symptoms of toxicity. There are early signs of toxicity. There is nausea, vomiting, anorexia. But one of the most common signs that you will see on the Nclex is vision changes. So if your client reports seeing yellow or green halos or blurred vision, you want to contact the healthcare provider immediately. Late signs of toxicity is bradycardia. You want to know the narrow therapeutic range, and that is 0.5 to 2. And the antidote for digoxin is digoxin immune fab. There are patients who are at higher risk for toxicity. These patients are people who are hyperkalemic or those who are on any kind of loop diuretic. There are also people who are suffering from hypomagnesemia or hypokalemia. And the elderly, everyone always forgets about the elderly. This would be a great select all that apply question. The elderly are more at risk for digoxin toxicity because they have decreased renal and liver function, which makes it harder for them to excrete out the drugs, so that the digoxin level continues to build up and they become more toxic quickly. So it's good to keep in mind who are most likely to be more at risk for toxicity. And another thing that is extremely important to know about digoxin is that if your pulse is less than 60, you want to hold the dose. So with these few slides, I'm just going to show you some names and how you can familiarize yourself with these drugs. These drugs are not the most top tested or asked on the Nclex, but I thought it was good for you guys to know. So some drugs that are antivirals, you will be able to differentiate them because they end with vir. And that's easy to remember because antivirals, VIR, and they end with vir, VIR. So that's an easy way to remember it. Another classification of drugs are antifungals, and these antifungals end with azole. So these are used to treat C. diff, and these will also can cause a metallic taste and dark urine. And when you're on these drugs, you want to avoid alcohol. And just like other drugs like phenytoin, you have to report Stevens-Johnson syndrome, which is a red rash with flu-like symptoms. Up, we are going to our antibiotics, and with our antibiotics we will be focusing on vancomycin. So antibiotics usually end with mycin or fluoxetine. Vancomycin, it is used to treat sepsis, so it kills bacteria in the intestines. This is good for C. diff. However, you want to make sure that you are monitoring the ears and your kidneys because these are ototoxic and nephrotoxic. So when you are on this drug, you want to monitor for tinnitus, and you can also monitor your kidneys through the serum creatinine. With this drug, you also want to monitor for red man syndrome, and this occurs if the medication was administered too quickly. When you are administering vancomycin, you want to administer it at least 60 minutes. And remember, to avoid toxicity, you want to draw peak and trough levels before administration. Next, we're going to be talking about our respiratory medications. One of the top tested respiratory medications that I will be listing here is albuterol. So with albuterol, you are able to use this for asthma or with patients with COPD. And this dilates your airways, which increases airway and helps you be able to breathe. So you have to be very cautious with clients who have heart disease, diabetes, glaucoma, and seizures because this can cause tachycardia. And you want to keep in mind the dosage for albuterol as well. Some of the side effects of albuterol is insomnia, nausea, palpitations, and tremors. Next, we're going to talk about our GI meds. There are a lot of GI meds, but I'm only going to show you guys the most important and the top tested ones. These are the proton pump inhibitors and the anemetics. So there are antidiarrheals, stool softeners, and laxatives, but right now we are just going to focus on the main ones. Ondansetron. With this drug, it is used for nausea and vomiting. You want to monitor heart rate and the rhythm, and you want to also administer this drug slowly because a fast push can cause QT prolongation. With omeprazole, this is used for GERD and ulcers. This decreases the amount of acid in the stomach. So you want to administer this drug 30 to 60 minutes before each meal. Omeprazoles are proton pump inhibitors. So all of the proton pump inhibitor drugs end with prozole. So that's an easy way to remember it. You want to report black tarry stools because that's an indication of GI bleeds. With the proton pump inhibitors, they also inhibit calcium absorption, so this decreases bone density. And this drug can also cause C. diff. All right, so now let's talk about our non-opioid drugs. Some classic ones that everyone is definitely familiar with is acetaminophen, NSAIDs, ibuprofen. Acetaminophen is Tylenol. That is like the most common drug I think that everyone probably knows. This drug is an indication for pain and fever. The max daily dosage someone should have is 4 grams. For long-term use, it should be 3 grams. And with this drug, you want to monitor for liver function. The antidote of this drug is N-acetylcysteine, and the therapeutic medication level is 10 to 30. So now we're going to talk about NSAIDs. So some example of NSAIDs are aspirin, ibuprofen, and ketoprofen. These drugs are used for pain, inflammation, and fever. So these drugs can cause prolonged bleeding and should be avoided in trauma and surgical clients. So before you are going into any kind of surgery, your doctor would instruct you and your nurse would instruct you to discontinue uses of these drugs 5 to 7 days before surgery. And these drugs can also cause peptic ulcers. So you would like to monitor your kidney levels, and also bear in mind that these can decrease the effectiveness of your diuretics. So let's dive into aspirin just a little bit more. So with aspirin, it's good to remember that it decreases platelet aggregation, which means it is going to be harder for your bloods to clot. So because of this, you are now at risk for bleeding, and you do not want to administer this drug with any other anticoagulants. And like I said before, you would like to discontinue this drug 5 to 7 days prior to surgery, and you want to be extremely cautious with using this drug with pediatric clients because Ray's syndrome can occur. You also want to monitor for toxicity, and some of the signs can be hyperthermia and tinnitus. Now let's just touch briefly on some opioid drugs. Some that everyone maybe knows is morphine, fentanyl, and oxycodone. Morphine. So morphine is used for pain, and one of the most common side effects is constipation, and it also is a CNS depressant. So you want to monitor for respiratory rate, and you also want to monitor the heart rate because these will be going down. And any kind of opioid antidote will be naloxone. Here are some top tested OB medications that I've seen on the Nclex. So there are tocolytics, which slows down the contractions, and oxytocin, which stimulates contractions. So one of the tocolytics is magnesium sulfate. This can be used for people who have seizures or asthma, but this can also be used for people who have preterm labor or preeclampsia. So magnesium sulfate is used to slow down the contractions. And some things that you want to monitor for is hypermagnesia, dizziness, confusion, weakness, and decreased reflexes. And you want to give this through the IV slowly. And the therapeutic level that you would like to remember is 4 to 7. This can also cause orthostatic hypotension. With oxytocin, it is used for induction of labor and for postpartum hemorrhaging. So this increases the contractions, and you want this because you do not want the mother to bleed out. For example, with postpartum hemorrhage, oxytocin would help the uterus to clamp down and create contractions to decrease the bleeding. So you would want to monitor her contractions. You would want to monitor the fetus. And you also want to warn the mother that the contractions will be painful. You definitely want to monitor her vital signs as well, her blood pressure, heart rate, and her glucose. Last but not least are steroids. The most common steroid that is tested on the Nclex is methylprednisolone. So this decreases inflammation. Steroids decreases your inflammation and usually ends in ON. So with methylprednisolone, it is used for inflammation, allergy, and autoimmune disorders. But with these kind of drugs, you want to make sure that you are monitoring for too much steroids. You don't want your patients to develop Cushing's syndrome. And one of the hallmarks for Cushing's syndrome is the buffalo hump. So some of the side effects of taking steroids is immunosuppression, hyperglycemia, osteoporosis, and delayed wound healing. And something that you also want to take in consideration is that this drug may mask signs and symptoms of infection. To help you guys be able to understand pharmacology a little bit more, I am selling this same PowerPoint if you want to go along with it over, or if you would like the study guide that I made based on these PowerPoints, you are able to purchase it. Just send me an email or DM me on Instagram. So that is it for this video. Please let me know if it was helpful for you and what you would like to see next. If you want me to continue on with this series, please let me know. Just leave them in the comment box below. Thank you so much for the support, guys, and I wish you well on this Nclex journey. See you later. Bye.